Today, I'm just going to talk a little bit about potential side effects, particularly of the medications that we sometimes use to treat arthritis in dogs. And so, the first one I would say that people tend to shy away from are steroids. We use steroids very occasionally, but rarely for arthritis in dogs. Mostly because we have more effective painkillers, but also because of the potential side effects around them. Particularly sometimes drinking a lot more, peeing a lot more, and sickness and diarrhea. In the long term, steroids can predispose humans and dogs to diseases like diabetes. But in the short term and at low doses, they can also be very useful for arthritis. We don't use them very often nowadays, though, because we do have medications that work a lot better. Non-steroidal anti-inflammatory drugs, and there are a whole range of them, Metacam, Loxicon, Rimadyl, Privicox, to name just a few. These are very effective anti-inflammatory painkillers, and they're used quite widely in veterinary practice. They work very well. Side effects that can sometimes be seen are sickness and diarrhea, and occasionally inappetence, so the dogs might not want to eat as well as they did, and very occasionally the most severe kind of side effects we might see are stomach ulcers and a little bit of bleeding from the stomach. If any of those side effects occur, then we ask to stop medication straight away. And then these non-steroidals, they can be used every day, but they can also be used every other day, or in a way that we call pulse dosing. So this might be treat for 2 days and then come off for 2 days, treat once every other day, treat once a week, or just treat for 3 to 5 days when symptoms are bad, okay? So those are non-steroidal anti-inflammatory drugs. Then we have other medications that we occasionally use. Some of these are human medications that we've adopted for animals, and particularly gabapentin is occasionally used for what we call neuropathic pain. It's a pain that's originating from nerve endings rather than associated to specifically inflammation inside the joints themselves. And gabapentin is a pretty safe drug. Can be associated sometimes with a little bit of sedation, occasionally a little bit of inappetence as well. And there's a wide dose range. So we start at a very low dose and then increase as we need to, okay? Other medications that are sometimes used in veterinary medicine, there are a wide range. Amantadine is one, it's another human medication. There's a range of tramadol type drugs. They're not as effective in most dogs as they can be in humans, and they can cause sometimes a little bit of what we call ataxia or wobbliness, and a little bit of sedation or quietness in the dogs, but generally they're well tolerated, but they're not so effective in most dogs as they are in humans. That's a little bit of an overview. Obviously, at our clinic, what we try to do is reduce medication as much as we can and use systems and treatments that avoid medication as much as we can. And those tend to be injections directly into the joints that are suffering with arthritis, either joint fluid replacement injections, platelet-rich plasma injections, stem cell injections, and then we try and reduce medication use as much as possible. And I hope that's very helpful, and I'll be posting some more videos very soon.